Hello, today I'll be demonstrating the proper technique on how to perform tracheostomy care and suctioning. First, we verify our order. Once we verified our order, we go and identify our patient. Once we identify our patient by getting them to state their name, their date of birth, we check their armband. After checking their armband, we gather our supplies. Once we check our supplies, we go ahead and wash our hands, don a gown and clean gloves and a mask. Then we provide privacy for our patient. We make sure that the order that they've given consent to perform the procedure. After giving consent, we'll go ahead and put our patient in a comfortable position. We'll go ahead and oxygenate them. Make sure that they take anywhere from 3 to 6 breaths to oxygenate themselves before we remove the cannula to perform the cleaning. So next, we've after we remove the sponge dressing, we go and wash our hands thoroughly, 2 to 5 minutes. After washing our hands, now we come and uh, prepare our sterile field to perform our sterile technique, which would be the tracheostomy cleaning. So now we go ahead and remove our supplies. We have a pad here, sterile pad. I've already prepared our area, washed and cleaned it down. Okay, now we have our gloves. We'll go ahead and open them. All right, we take our non-dominant hand and get on our dominant glove. And we take our dominant hand and put on our non-dominant glove. Now, we can remove that. Now we take and we can add our supplies to our sterile field. We add our peroxide and our sterile in one compartment with sterile saline. Go ahead and remove our cannula and add it to the peroxide solution. Let it sit. Next, we get our brush and we take and we clean the inside of our cannula, making sure that all of the mucus and everything has been cleaned and removed. After we've cleaned it with the brush, we take it and sit it in our sterile solution, sterile saline, and let it rinse. Rinse it out. And we take and let it dry. Once we let it dry, we insert it back into at an angle until it slides in. Secure it if it needs to be secured. We take, once it's back in place, we take the swabs and clean any excess mucus or anything that needs to be removed. Okay, change the ties if necessary. Make sure that you replace it with a sponge underneath to keep add the protection underneath there. So once you've added, replace the straps if needed and the sponge, um, now you make sure it's secured. If you have to change the ties, you do one at a time. Make sure that you hold in place while removing and until one side is secured. Okay, and replace the oxygen after completion. Remove your supplies. Document